Welcome, everybody. My name is Munir Mohammed. I chair the UK Pharmacogenetics Stratified Medicine Network, and this is our 5th annual meeting. You'll be glad to hear that we've been sold out for the last 2 years, and we sold out this year as well, which highlights that this is an important area, increasingly popular area for people to come to meetings like this. And we've got a fantastic lineup of speakers today, covering many different areas. I'm just going to give you a brief opening about where we've got to with regard to the network and what we're planning, and then introduce the first speaker. So the network is about 6-7 years old, and the important thing about the network has been that the membership has been increasing year on year. And when we sometimes talk about membership, it's sometimes an institution is represented as one member, so there are many more than on the slide there. And the increase in network membership has largely been due to the hard work put in by Christine McNamee, who manages the network, and Nathan Elsden, who manages the kind of social media website aspects of the network. Again, this is a multidisciplinary network, which is very important. This is a really complicated area. We can't do it by ourselves as clinicians, academics. We need to work in collaboration with industry, with regulators, and not only pharma, but also diagnostics and the data science companies in order to make this work. And the rationale when I set up the network was that we really need a multidisciplinary partnership within this, so that people can meet each other in meetings like this, and there's networking time today, but also really try to enhance collaboration. And we enhance collaboration in many different ways through these meetings, but also by the website, and I'll come back to that in a minute. The network is starting to attract global attention as well, in terms of people coming in from outside the UK. We've had larger numbers of visitors from outside the UK, and not only staying for one click, but staying on the website for several minutes and looking at different aspects of the website. And there are people here today in the audience who are not from the UK who are attending in terms of some of the interests. So it is important to make this a global initiative. Now, social media is obviously very important nowadays, and we do have a social media following both in LinkedIn and Twitter, and again increasing. And there is a hashtag for today's meeting, so please do tweet away. It's on your book, and also our Twitter handle is on the screen at the moment. As I said, we do have a website, and we have many different things on the website, which includes the events, not only our events, but other events which may be related to stratified, precision, personalized medicine, relevant publications which come out, including reports, any grants or funding sources which have been advertised, we put on the website. But we also put down presentations from our meetings that we hold, so that people can visit them at any time to be able to understand what is, what has been said in different workshops. We hold a few workshops, and I'll come back to that again in a minute. So we do have an online collaborators database, and you can access that. You can find out who is doing what work in the UK, if they're registered on the database, and then you can try to make your own collaborations and networking via the website. And again, if there's anything that's unclear, please contact Christine McNamee or Nathan, and they are very keen to be able to help and engage with you. So what have we done in 2017? Last year? Well, we had our annual meeting here again last year, but we also held some workshops with key stakeholders or key organizations in the UK. So the first one was really genomic research in primary community care, and this was held with the Royal College of General Practitioners, which is where we are today. And genomics in primary care is important, and again, we held another one which is more looking at stratified medicine type work in primary care, again, and Phil Evans, who led that, is again in the audience today. Another one that we held was with NHS innovation. An important aspect of precision personalized medicine is going to be the entrepreneurship, the disruptive innovation, and the personalized medicine approaches which are required. And Tony Young, who heads NHS innovation, has been developing an entrepreneurship scheme, and he's got a lot of young entrepreneurs working in the NHS and other areas in the UK who are involved in this, and looking at how they can develop that disruptive innovation which is really needed to take things forward here. And again, the recordings of presentations from these workshops are available on our website. Now, 2018 has already been busy year, and we've got a program of work lined up. And if you're interested, then please sign up to attend some of these meetings. We've already had a workshop on pharmacogenomics in the NHS. That was with NHS England, Genomics England. I'll come back to that a bit later on in a later talk. On the 3rd of May, we're holding a workshop with the MHRA, and this is really looking at what are the regulatory pathways for genomic testing in the UK. There are many different organizations at the moment which are regulating genetic testing. How can we develop streamlined pathways for the UK, which make sure that there is a degree of proportional regulation, but it's not over-regulated, because we need to make sure that innovation is not disrupted in any way by over-regulation, and that's very important. And later on this year, 10th of October, and this is with the NIHR Clinical Research Network Hub that Michael Beresford leads, and Michael will be talking to you later on. This is really developing and delivering stratified medicine studies through the NHS. Recruiting to those is critical, and the clinical research networks are critical to delivering those studies. And Michael's been leading a program on developing a roadmap of how you ensure that you get appropriate recruitment, quick recruitment to those studies. And he'll tell you about that later on, but also there's a follow-on workshop to see how we can start implementing that roadmap that he's developed. The other aspect about it is the global aspects. And working with the NIH Pharmacogenetics Research Network and with the UKPGx network, which is a European pharmacogenetics consortium, what we've done is developed a meeting which is called the Global Consortium Meeting in 2018. And the idea behind that is to say, well, actually, pharmacogenomics is going on all around the world, but we're all working in isolation at the moment. Can we form a global consortium so that we can actually start attracting stakeholders from many different areas, and really taking this forward, catalyzing the works of collaborating, innovating across country boundaries to drive forward the science of pharmacogenomics. And that's going to be held in June 2018. And the outcome from that may be some kind of global consortium or a global society. We don't know, but we really need to have the discussions then. And I'm very grateful to my partners at the NIH as well as the UKPGx consortium in helping to develop that meeting. So I just want to finish off by thanking our sponsors for today, they're listed on the slide, but also our exhibitors. So please do go and visit the stands. Just to let you know that the network at the moment is currently funded by the Coordinating Research Center for NIHR, UCB Pharmaceuticals, and the Northern Health Science Alliance. And we've also had funding from NHS England for running the workshop. So that's just an overview of where we're at. Obviously, we've started planning our next meeting as well for 2019, and it's going to be here again on the 20th of March 2019. So please put that in your diary, and hopefully you can attend that as well. Thank you very much for coming today.